All right, let's talk about the most obvious thing that happens during pregnancy that everybody expects. My book is called What You Don't Expect. This one we always expect, right? The low back pain, the picture of the woman that's arched forward and her back is killing her and she's holding her back. Everybody expects that. As you can anticipate, if you strap 25 pounds on the front of you, this area gets incredibly stressed, right? So the forward motion and the lordosis that happens, it's an obvious storm of why our patients have low back pain. One thing that you can help with that is a belly band to help with this area, to help support this area. But as you can see, biomechanically, this is the issue that everyone expects. Where that's taken one step further is sciatica, right? If we go forward like this, the muscle in our butt called the piriformis, 5% of the population have the sciatic nerve pierce through that muscle, and when it spazzes because it's trying to keep the brakes on, that causes a resultant sciatica. It is common for women to have a disc bulge during pregnancy because this is a lot of force on an already weakened system. On top of that, having their provider tell them, hey, there's nothing we can do, and they go home and do nothing, they're deconditioned, they decide to lift a suitcase and twist, and it's a perfect storm. So that's how you typically get sciatica during pregnancy. Everybody carries their baby differently. So if a baby is higher or lower, I'm not going to show you that, it can pinch in different areas because we all know from physics that doing this at different angles or different inches from the top of your belly, you're going to have a different stress at every level. So if the baby's a little bit lower, the force will be higher up here in this upper lumbar area, and that's how you get what's called myalgia paresthetica. Myalgia paresthetica is a pinching or an impingement of the top 3 lumbar bones, 1, 2, and 3, and that resultantly causes pain in the thigh where somebody can't even stick something in their pocket because it's painful. It's a sensory nerve innervation problem that's caused by pinching up here because this here pinches or creates too much of a lordosis in the upper spine. Typically in the lower section is where you'll get the sciatica or the back pain because that's where the nerves go into the butt.